bringing you the news and information you need from the people making a difference. This is Comcast Newsmakers.
Well, I'm glad you could join us. There's an interesting project coming up in San Francisco and to help people who otherwise might not have the help. It's called Clinic by the Bay. And fortunately for us, we have folks who are involved in that. Janet Reilly is president, co-founder, and also Scott Hauge, and I hope I pronounced that correctly. And this is an interesting project, Janet. I mean, this is something that's going on around the country. Is that right?
It is. It's a community health clinic. Clinic by the Bay is part of a network of clinics called Volunteers in Medicine. And Volunteers in Medicine clinics, they're specifically targeted, they're free healthcare clinics for the working uninsured, run by retired doctors and nurses.
Okay. Now, when you say free, that a lot of people's ears perk up because we all know what it costs to be sick.
Yes.
Or to be checked up or to have your children vaccinated, that kind of thing.
It truly is free. We don't take any Medicare or Medi-Cal or any money from anybody. We also don't take any government money. It's all privately raised.
Okay. The question immediately comes to mind, how do you support yourselves?
Well, we have many grants from great companies and individuals, and so we're all privately funded. And we have volunteers. The clinic is run primarily by volunteers, so our overhead and patient visit is quite low.
Okay.
I would like to point out that we have 78 clinics in 25 states, and in all the years since 1992, we've only had one clinic fail.
That's amazing. All around the country.
All around the country.
All around the country.
So
where did you start? Where did it start?
Well, it started in Hilton Head, South Carolina. Dr. Jack McConnell, who was one of the founders of Tylenol and the MRI, retired down to Hilton Head and found that 1/3 of the population had no access to health care. That clinic now is serving 28,000 patient visits a year at a cost of about $40 per patient visit.
This is going to be in the Excelsior district of San Francisco, is that right?
Yes, it is. We're going to be in the Excelsior
generally
district.
Sort of a lower income, middle income kind of place. Now, I want to be clear about this, though, Janet. I'm a family. I've got 3 children, and I can't afford to get health care or something. I can walk in. My child has got some illness. I don't know what it is. They can be taken care of.
Well, it is a very strict eligibility criteria.
Okay,
so you have to be at
250%
of poverty level, which is about $27,000 for a single person and about $55,000 for a family of 4. And you have to have no insurance. So it is. So you will come in. You will be seen by an eligibility screener to see whether or not you qualify for the clinic. And if you don't, we can send you out to other clinics or other resources.
Okay. Isn't there a motivation for people not to have insurance if they know that they can get insurance? I mean, they can get care without having the insurance, though, and without paying the premium for it? I mean, how does that balance out?
I don't think so. I think all of us would like to have insurance. So, but unfortunately, the costs are so high. I just saw today that the cost of, medical insurance this year will probably go up about 9%. And so it's really unaffordable for folks.
And the other thing you've got to keep in mind is that a lot of these people work for small companies that aren't providing health insurance. So it comes down to a cost situation for them.
And they're not providing it, or they're taking it away because people can't afford it. I mean, this is obviously one of the major problems in the country at this very moment.
It is.
And now the other places all operate on the same basis?
Same basis. Same basis, and very, very successful. And so many doctors, particularly retired doctors, love to work there, nurses, because it's old-fashioned medicine. We spend about 30 to 45 minutes with a patient. So we say, and there's no billing. They don't have to deal with any forms or, any bureaucracy. It's just coming in and practicing medicine like they used to practice.
That's an interesting concept, though, old-fashioned medicine.
But in a very high-tech environment. We're going to start out with electronic medical records, so it's a very modern facility, but old-fashioned medicine.
I think one of the things that attracts the doctors is the time that the doctor meets with the individual is 45 minutes, which is so much different than if they go to a normal clinic.
Right. In and out. Take 2 aspirin and call me next month.
Not a clinic by the bay.
Not a clinic by the bay.
Not a clinic by the bay. And they all operate on the same basis.
Yes.
All of them, all across the country.
Well, they're not cookie-cutter clinics. Really, they are specific to each community and the community needs. And we decided to put the clinic in the Excelsior district because there really, truly was a need there. Okay, well, let's leave the audience with remembering that Clinic by the Bay will be opening in San Francisco in the fall. And Janet Reilly and Scott Hauge have been our guests. Thank you very much for watching.